heart screenings are what really can save lives. And you have been working for many years, as long as I've known you, on running these heart screenings at towns, events, everything like that. And you've saved quite a few lives doing that way. Many many results of people coming and thanking you and saying, you know, hey, I never know I had this problem. People that you would swear looked healthy. One guy I know he was a weightlifter, he was working out all the time, and you found something on him. So let's tell the public a little bit what's going on in the heart screening, that they don't have to be afraid, that they're not going to be laid on the table and poked and stabbed and everything else like that.
So once, we've been talking about this for a long time, that a lot of people die for no specific reason, especially now that we can take care of them by simply screening them for heart disease, since the heart disease is number one killer. We started to do this screening for many years, as you know, for different towns, different villages, different counties, and as a result, we were able to save a lot of lives, which that's very satisfactory. That's very pleasant for me. That's what I do it. The way we do it is simply we look at their blood pressure, their family history, and we educate them about the signs and symptoms of the heart attack, and we do a EKG electrocardiogram that looks at the heart activity, and based on if there is a specific or there's signs of that on the EKG, we take it seriously, we take it to the next level. So what we have done in Heart and Health Medical to just do something to give back to the community and help our neighbors, our family, we started to donate our time and do these health screenings in different villages and towns and community service centers. The way we do it, we simply take their blood pressure. If their blood pressure is high, or if the EKG is abnormal, if they have any specific symptoms, we refer them to their doctor with the specific recommendations. And if they don't have a doctor, we will help them out. Obviously, all these programs that we have done and all these screenings that we've done, no medical insurance is necessary. And we actually, for this year in 2018, for February, we started to do Long Island-wide heart screening for only $20. So for $20, we can evaluate you, and we hopefully, and no medical insurance is necessary. And if there is any significant problem, we can take care of it. And our hope is to prevent unnecessary deaths.
So just to give a step-by-step, play-by-play, because I've had a heart screening myself. The first thing you would do is you would walk in, you would fill out paperwork, which basically about your family history, how you're feeling, stuff like that. Second of all, one of the beautiful people that we have working at Heart and Health would come by and put a little thing on your finger. And what this is called is a blood oxygen test.
Correct.
Right? And the blood oxygen test tells us how much oxygen is in the
circulating
blood.
Through your system.
Right. So then you would relax a little bit, and then somebody would come and take your blood pressure. Again, non-invasive. Nobody's cutting you open. There's no blood drawn or anything like that. Then the next step is that you would be taken into a room where you'd be giving an EKG.
Correct.
Right? And the EKG, the results would come back. They're pretty instantaneous. And then those results would go to you for review. And then the patient, or the person who got the heart screening, would sit down with you and discuss the EKG, their results, the blood pressure, and the blood oxygen. And that's that simple.
That's as simple as it comes. So we don't hold on to any information from the patients. We give all the information back to the patients, and we explain to them what needs to be done if there is a problem. If there is no problem, that's actually good, because they can be confident that they don't have a heart problem and they can go on with their life. But if there is a problem, it's important to fix the problem. Our goal is to prevent heart disease. Our goal is to save lives. And that's what I went to medical school, and that's what my passion is.
So who do you recommend should get these screenings?
So if someone has a pain or symptoms of the heart attack, chest pain, shoulder pain, jaw pain, palpitation, shortness of breath, dizziness, irregular heart rate, all those things could be a sign that there's something wrong. So anyone who has those, that doesn't matter if it's male, female, despite of their gender, they should be evaluated. If you have a family history, if someone in your family died early in their life, if you have diabetes, if you have high blood pressure, if you're a smoker, if you're under a lot of stress, if you work on kind of a stressful environment and you stress all the time. So if you have the risk factors, definitely. If you have the symptoms, absolutely. And especially with the fact that it's a very cheap way of a screening. I mean, and if you find a problem, that could be potentially life-saving. So I think risk and reward is totally good for the patient because there is not that much risk. It's not invasive. There is nothing is going to be injected to you, or you're not going to be radiated.
There's
or
no
any of
reason to
those
be
things.
scared.
Correct. But you get all the information that you need, and from those information, then you can make a determination and decisions what you want to do. I think the most important thing is knowing the facts and knowing the information. Then ultimately, you as a patient make that informed decision, and as a physician, we will support you.